Welcome to the Career Pathway Channel, guiding nurses on the pathway to success.
Hello, great nurses. Welcome to the Career Pathway Channel, where we guide nurses on the pathway to success. This is NUS 113 Applied Anatomy 1. In Module 1, we were made to understand the structure and organization of human body and cell. Here in Module 2, we want to understand the structure of the musculoskeletal system. Specific objectives for Module 2 are as follows. 1. To describe the development, structure, and composition of bones. 2. To explain the development and structure of compact and cancellous bone tissues. 3. To explain the following anatomical terms relating to musculoskeletal system: proximal, distal, lateral, etc. 4. To describe the bones of the human body: skull, pelvis, vertebrae, ribs, femur, tibia, humerus, etc. 5. To list the types of muscles in the human body. 6. To explain the different types of muscles and tissues listed in 5 above. 7. To describe the characteristics and composition of the muscles listed in 6 above. As we all know, the circles to success indicate the following. Red circle tells us that these areas are a must-know for our examination. Orange circle tells us that these areas are good for clinicals, while green circles ask us to skim over this video at later times. We'll begin with specific objective number 1, to describe the development and structures, including the composition of bones. Take note of this. When you assess a patient with osteoporosis, you are not just seeing weak bones, you are seeing collapsed trabecula and reduced calcium hydroxy appetite. This is why a simple fall causes hip fracture. As we all know, osteoporosis is a disease that results from weakness and brittle bones. Trabecula, on the other hand, is a group of connecting tissues. A group of connective tissues that form cancellous bone. Calcium hydroxyapatite is a form of calcium phosphate, which is the main mineral component of bones and teeth. So let's begin with bone development. What is bone development? Bone development can also be called the ossification of bone. It is divided into 2 parts. The bone development or ossification can be intramembranous or endochondral. In intramembranous ossification, the bone develops directly from connective tissues. Example of such bones include the skull and the clavicle. In endochondral ossification, bone develops from cartilage instead. Example is the long bones such as the femur. We are going to look at the terms, we'll define them, and we'll look at the nursing application. In intramembranous ossification, example is the flat bones such as the skull and the clavicle. They develop directly from the mesenchymal tissues. Let's look at the nursing application. With regards to intramembranous ossification, cranial molding in newborn is an application. There are areas of the skull of the newborn called soft spot, which are also regarded to as fontanelles. If these fontanelles are bulging, it will lead to increase in intracranial pressure. If these fontanelles are sunken, it will lead to dehydration. There is therefore need for proper molding in the newborn. We also look at endochondral ossification. In endochondral ossification, long bones form from cartilage model, which are later replaced by bones. Nursing application. With regards to endochondral ossification, the growth plate, which is also called the epiphyseal plate, remain cartilaginous until 25 years. So, at 25 years, the growth plate closes and becomes solid bone. Injury at this point may lead to growth disturbance, which is common in pediatric fractures. Bone structure. The structures of the bone are basically 4 main structures. The first one is epiphyses. Epiphyses are found at ends of long bones. Diaphyses. Diaphyses are the shaft of long bones. Periosteum are the outer covering, which is rich in blood vessels and nerves. 4. The medullary cavity. Medullary cavity contains bone marrow, as you can see in this typical illustration of the bone. So we want to look at the terms, definition, and then the nursing application of bone structures. The first one here is the periosteum. It is the outer fibrous layer with blood vessels and nerves. How does it apply to nursing? It is very painful if it has fractures, because periosteum is highly innervated, which is highly made of connective tissues and blood vessels. So there is need to avoid pressure on fractured areas. The next one is the compact bone. Compact bone is a basic bone structure that is made of about 80% of the bone mass. It is the dense outer layer of the bone. How does it relate to nursing? It provides strength. Fracture at the compact bone will lead to high force trauma. Example is in car accidents. Destination for bone structures, we look at cancellous bone. Cancellous bone is a bone structure that is the spongy inner layer made of trabecula. How does it relate to nursing? It is affected in osteoporosis. Osteoporosis means weakened trabecula. In elderly, it could result to hip fracture. There is therefore need to assess fall risks in patients more than age 65. Medullary cavity is another bone structure. It is the center of the bone that is filled with yellow bone marrow or fat. How does it apply to nurses? The bone marrow aspiration procedure is done at the medullary cavity. As you can see, this picture illustrates the medullary cavity and the bone marrow aspiration procedure. It is usually carried out at the posterior iliac crest. Take note of this. There is therefore need to monitor for bleeding after the procedure. Let's look at bone composition. The bone is majorly made of two compositions: organic part composition and inorganic part. The organic part composition of bone is made up of 30 to 35%, while the inorganic part of bone is made up of 65 to 70%. For the organic part, it is majorly made of collagen and it helps to give flexibility to bones. The inorganic part of bones is made of 65 to 70% and it's mainly contained of calcium phosphate, which helps to harden the bone. In a nutshell, we want to look at the components of bone, the percentage of bone mass, and nursing implication. Collagen. Collagen is part of organic part of the bone and it's made up of 30% of the bone. Nursing implication. There is need for vitamin C, as vitamin C deficiency could result to scurvy. This will lead to weakness in collagen and lead to bleeding in our gums and poor wound healing. The next component is the calcium hydroxyapatite. We have said that calcium hydroxyapatite is a form of calcium phosphate that is the main mineral component of our bones and our teeth. It is made up of 65% of inorganic part of bones. How does it apply to nursing? It results to hypocalcemia, which results in muscle cramp and tetanus. There is therefore need to monitor for Sjostak's sign, which is facial twitching in our patients. So when we see this sign in our patient, we know that this patient is hypokalemic. The next component of bone is water. Water is made of 5% of bone composition. How does it relate to nurses? There could be dehydration of bones. Dehydration could lead to brittle bones, leading to risk of fracture. This is particularly in 30% of elderly. Objective number 2. We want to explain the development and structure of compact and cancellous bone tissues. Take note of this. In elderly patients, cancellous bone fractures such as fracture in the vertebra, fracture in the wrist, and fracture in the hip are silent until very severe. There is need to screen for height loss in elderly. If you examine the height of the elderly and there is height loss greater than 4 cm, this could be vertebral fracture. Let's examine compact versus cancellous bone. Compact bone can also be called cortical bone. They are dense, they are strong, they form the outer layer of bone. They contain the Hervesian system. The Hervatian system can also be called the osteon. The Hervatian system is the basic structural and functional unit of the compact bones. One thing you need to know is that it is a microscopic cylinder that runs lengthwise through the bone. It helps the bone to stay strong, and it also allows the passage of nutrients and waste in the bone. It is also made of several parts, such as the central line, the lamella, the calcuna, the osteocytes, and the canaculi, including the Proximal canal, which is also called the perforating canal. So it is the basic structure and functional unit of the compact bone. The functions of compact bone is that it provides strength and support. The next one is the cancellous bone. Cancellous bone can also be called spongy bones. They are found at the epiphysis and inside the flat bones. They contain trabecula. Trabecula is a meshwork with red bone marrow. Functions. Cancellous bone function in that they are lightweight, they help in lightweight, and they produce blood cells. In a nutshell, let's look at the differences between compact and cancellous bones. We'll look at the fissure, we'll look at the fissure of compact bones, we'll look at the fissure of cancellous bone, and then we'll look at the nursing application of these bones. Location. Compact bones are located at the outer layer of all bones. They form the shaft of long bones. Cancellous bones, on the other hand, are located at the ends of long bones. They are found in the interior of flat and irregular bones. How does this apply to nursing? It is applied in hip fracture. Hip fracture often involves the femoral neck, which is also a cancellous bone. One thing you should note that if there is fracture at the femoral bone, it will heal poorly due to reduced blood supply. With regards to structure, compact bones are tightly packed. They are made up of Hervatian system. For cancellous bones are made of lattice of trabecula with red marrow in their spaces. How does it relate to nursing? Osteoporosis primarily affects cancellous bone, leading to vertebral compression fractures, which is usually evidenced by loss of height. Function. Compact bones functions in order to strengthen, for protection, and for leverage. Cancellous bone, which are spongy bones found inside bones, especially in vertebrae, pelvis, ribs, and the end of long bones, functions to help in shock absorption and metabolic activities, which includes the storage of calcium. How does this apply to nursing? It is applied with regards to biphosphonates. What are biphosphonates? Biphosphonates are a class of drugs used to treat bone diseases when bone breakdown or reabsorption becomes too fast, especially in diseases such as osteoporosis and Paget's disease. Examples of biphosphonates are alendronates and residronates. Another feature of compact and cancellous bone is blood supply. With regards to blood supply, compact bones are very rich with blood supply via nutrient artery. Cancellous bone, on the other hand, is limited with regards to blood supply, and it is vulnerable to ischemia. Nursing application with regards to blood supply. Femoral neck fracture risk avascular necrosis. There is therefore need to monitor for hip pain after injury. With regards to clinical relevance, compact bone fractures require surgical fixation. Cancellous bone heal faster but more prone to osteoporosis. What is the nursing application? The nursing application is in vertebroplasty. A substance called cement is injected into cancellous bone. Cement is composed of ppm. ppm, that is polymethyl methacrylate. There is therefore need to wash for cement leakage. If this is not checked, it will lead to neurologic compromise. Objective 3. Anatomical terms with regards to musculoskeletal system. Anatomical terms in musculoskeletal system include proximal, which means closer to the point of attraction. For instance, the elbow is proximal to the wrist. 2. Distal. Distal means further from the point of attachment. Example, the fingers are distal to the elbow. 3. Medial, which means nearer to the midline. Example, the big toe is medial. 4. Lateral. Lateral means away from the midline. Example, little toe is lateral. 5. Superior. Superior means above. For example, the head is superior to the chest. Number 6. Inferior. Inferior is below. For example, foot is inferior to knee. In a nutshell, we look at positional terms and how they can be used in nursing application. Proximal is closer to the trunk. Example, the shoulder is proximal to the elbow. An IV infiltration proximal to site will lead to more swelling. There is therefore need to stop the infusion immediately. If there is an IV infiltration, it means the line is in the tissue. There is therefore need to stop the infusion immediately. Another term is distal. Distal means farther from the trunk. Example, the wrist is distal to elbow. Example, an application to nursing. The radial pulse is distal to the brachial. It is used when the upper arm is injured. Medial. Medial means towards the midline. Example, the nose is medial to eyes. In nursing application, medial meniscus tears can cause knee instability. There is therefore need to assess for joint locking. Continuation, we look at lateral. Lateral means away from midline. For example, the ears are lateral to the eyes. Nursing application. Inject intramuscular vaccines in lateral deltoid, not near the radial nerve. So in example, in application lateral is applied to nursing the following ways. Intramuscular vaccines are injected at the lateral deltoid, not near the radial nerve. The next one is superior. Superior means above. Example, ribs are superior to pelvis. It's applied in nursing relevance with regards to inferior vena cava filters. Inferior vena cava filters are placed below the renal vein. There is therefore need to monitor leg swelling. Flexion means decreasing the joint angle, as in to bend it. With regards to flexion, nursing application, hip flexion less than 90 degrees is very relevant with regards to post-total hip replacement. This to prevent dislocation. Extension. Extension means the increasing of joint angle, which is also called straightening. Nursing application. It is applied with regards to contractures. Contractures will result in permanent extension limitation. There is therefore need to ensure range of motion exercises to prevent these contractures. The next one is adduction. Abduction simply means moving away from the midline. Abduction pillows are used in post-hip surgery, which keeps the femur stable. The next one is adduction. Adduction means moving towards the midline. Nursing application. If there is an adduction of the leg that crosses the midline, it will increase hip dislocation risk. The next one is supination. Supination is palm up, which is an anatomic position. So in supination, the palm is up. Nursing relevance. Intravenous fluid in supinated hand has slower infiltration because the veins are less superficial. The next one is pronation. In pronation, the palms are down. How does this apply to nursing? Pronated hands, which means the patient is facing downwards, right? Pronated hands will result in faster infiltration risk. So there is need to check hourly. So most times, if the IV line is in the vein for patients who are pronated, there is need to check for infiltration hourly. However, if the patient is supinated, it will take a longer time for infiltration to occur. Objective number 4. We want to describe the bones of the human body. Bones such as the skull, the pelvic, the vertebra, the ribs, the femur, the tibia, and the humerus. Bones of the body includes the skull, which protects the brain and contains facial bones. Vertebra contains 33 bones in total, involving the cervical, the thoracic, the lumbar, the sacral, and the coccygeal. The ribs, there are 12 pairs. They protect the thoracic cavity. Number 4, the pelvis. The pelvis bone supports body weight and protect pelvic organs. Number 5 is the femur. The femur is the longest bone in the thigh. Number 6 is the tibia. The tibia includes the shin bone, which helps in weight bearing. Number 7, humerus. Humerus is the upper arm bone. The knowledge of bones is crucial for fracture management in orthopedic, for injections, and also in physical assessment. So in a nutshell, we want to look at the bones of the body and their nursing focus. In the skull, the key bones in the skull are the frontal bone, the parietal bone, the temporal bone, the occipital bone, the maxillar bone, and the mandible bone. Answer this question in the comment section. Which of these bones is the only movable bone of the skull? Let's look at the nursing focus. The cranial nerves exit the skull. Example, the cranial nerve 7. The cranial nerve 7 exits the skull. If there is a skull injury, it will lead to Bell palsy. So a facial trauma will affect the cranial nerve 7, which will lead to a paralysis of the face. It may also lead to battle sign, which is called mastoid ecchymosis, resulting in basilar skull fracture. There is therefore no need for nasogastric tubes. Take note of this word, mastoid ecchymosis. Mastoid ecchymosis means the bruising appearance that appear on the mastoid bone. When there is a basilar skull fracture involving the temporal bone, this bruise will appear because the blood leaks from the fractured base into the tissues around the ears. That's for mastoid ecchymosis. And if there is a basilar skull fracture, patients with basilar skull fracture do not need nasogastric tubes. This is because basilar skull fracture will fracture the thin bone between the nose and the brain, which is the cribriform plate. So the cribriform plate will be affected, so nasogastric tube will accidentally enter the brain through these fractured areas. The next one is the vertebra. The regions of the vertebra are the cervical, the thoracic, which is 12 thoracic, 5 lumbar, 5 sacral, which is fused, 4 coccygeal, which is also fused. What is the nursing focus? In the cervical vertebra 1 to cervical vertebra 2, if there is an injury to C1 or C2, there will be airway risk because of the phrenic nerves. The phrenic nerves C3 to C5 will be affected, which may reduce respiration, leading to death. With regards to the vertebra, L1 to L5 are the lumbar vertebra. If the lumbar vertebra is fractured, it will lead to a condition called cauda-equina syndrome. What is cauda-equina? Cauda-equina is a bundle of spinal nerve and nerve roots which are located at the lower end of the spinal cord. If they are damaged, it will lead to cauda-equina syndrome. Symptoms of cauda-equina syndrome include severe lower back pain, loss of bladder and bowel control, saddle anesthesia. Saddle anesthesia means loss of sensation in the inner thighs, just around the genitals. This syndrome is a surgical emergency. There is therefore need to monitor for saddle anesthesia, which simply means a loss of sensation in the inner thighs and around the genital. In fact, this is a surgical emergency. So there is need to take the patient immediately to the theater in order to prevent permanent nerve damage. The next one is the ribs. With regards to the ribs, there are true ribs, false ribs, and floating ribs. Rib 1 to 7 are known as true ribs. Ribs 8 to 10 are known as the false ribs. Ribs 11 to 12 are regarded as the floating ribs. What is the nursing focus? There is a condition called flail chest condition. In flail chest condition, there is about 3 or more rib fractures. This will lead to paradoxical movement of the chest. In other words, the abdomen will be upwards and the chest will fall downwards. There is therefore need to stabilize a patient with this condition with a little pressure during transportation to the hospital. The pelvis. The pelvis bone include the ilium, the ischium, and the pubis. The pubis is fused at the acetabulum. This is the positive objective question. Nursing relevance. The pelvis is relevant in pelvic fractures. Pelvic fractures are very life-threatening conditions which could lead to serious bleeding. This bleeding could be up to 2 liters blood loss. There is therefore need to check for hematuria, which is blood in the urine because of urethral injury. The femur. The femur bone is made up of the head, the neck, the shaft, and the condyle, as we can see in the illustration. Nursing focus. Hip fractures. Hip fractures occur in femoral neck. Femoral neck fracture may lead to 20% mortality after a year in elderly. So if there is a fracture for the elderly and it leads to complication, the elderly may not survive for more than 1 year. So early surgery is needed in less than 48 hours, and this will reduce such complications. The next one is the tibia. The key parts of the tibia includes the medial malleolus and tibial tuberosity. In application, there is a condition called compartment syndrome. Compartment syndrome, as we all know, the muscles of the extremities are built into compartment. Pressure to these areas will lead to compartment syndrome. There are 6 P's to watch out for in compartment syndrome. First P is pain, second P is pallor, third P is paresthesia, fourth P is paralysis, fifth P is pulselessness, sixth P is poikilothymia, which is the inability of the body to regulate its own temperature. The next bone is the humerus. The key parts of the humerus are the head, the surgical neck, and the radial groove. Nursing focus. With regards to humerus, there could be radial nerve injury, which is known as humeral fracture. This will lead to a condition called wrist drop. There is therefore need to monitor for hand weakness. You must understand that the radial nerve supplies the wrist and the fingers. Wrist drop is the inability to extend the ribs and the finger. The nurse must watch out for this. With regards to the bones of the body and their nursing relevance, there is this memory aid that will enable you to remember the bones of the body. The memory aid is SVRO-PFTH. What does it mean? SVRO, save patient from trauma hero, where S is skull, V is vertebral column, R is rib, P is pelvis, F is femur, T is tibia, and H is humerus. Objective 5 and 6 will be looked together. So we'll examine the muscle types and explanation. Take note of this. When you give neostigmine for myasthenia gravis, you are boosting acetylcholine at the skeletal muscle junction. There is therefore need to monitor for cholinergic crisis, which involves the symptom of sludge. And sludge means salivation, lacrimation, urination, defecation, GI upsets, and emesis. Muscle types. There are 3 basic muscle types: the skeletal muscle, the cardiac muscle, and the smooth muscle. Let's explain them. The skeletal muscle is voluntary, it is striated, and it is attached to the bones. Its function is for movement and for postures. The next is the cardiac muscles. The cardiac muscles are involuntary, they are striated, they are branched, and they are only found in the heart walls. They function to pump blood continuously. The next one is the smooth muscles. Smooth muscles are involuntary, they are non-striated, they are found in the walls of hollow organs. Hollow organs such as the stomach, the intestine, the bladder, and the blood vessel. They function to move substances through the body. In a nutshell, let's look at the muscle types and their nursing relevance. The first one is the skeletal muscles, which are striated. They are attached to the bones, they are voluntary. How does this apply to nurses? With regards to skeletal muscles, nurses must check out for weakness. If a patient has weak muscles, it will lead to fall risk. We also watch out for critical illness myopathy. Critical illness myopathy occurs for patients who have been kept for a long time in the ICU. There is need for early mobilization for patients in the ICU. So do not leave a patient lying bedridden for long. Ensure that the patient carry out some ROM exercises to keep them mobilized. The next one is the cardiac muscles. Cardiac muscles are located in the heart and they are involuntary. How do cardiac muscles apply to nursing relevance? They are relevant with regards to myocardial infarction. Myocardial infarction simply talks about cardiac muscle death. There is therefore need to monitor for arrhythmia, which is abnormal rhythm of the heart. The next one is smooth muscles. Smooth muscles are located in hollow organs such as gastrointestinal organs, blood vessels, and uterus. They are involuntary. Nursing relevance for smooth muscles are in hypertension. Excessive vascular smooth muscle contraction will lead to hypertension. There is therefore need to assess for headache and vision changes, which are symptoms of hypertension. We want to look at the characteristics of the muscles and their differences. The first characteristics and difference of these muscles are in their appearance. Skeletal muscles appear striated and long fibered. Cardiac muscles appear striated and branched. Smooth muscles appear non-striated and spindle-like in shape. The nuclei. The nuclei of skeletal bones are multiple and peripheral. The nuclei of cardiac bone are single and central. The nuclei of smooth muscles are single and central. With regards to contraction speed, skeletal muscles are fast, cardiac muscles are moderate, smooth muscles are slow with regards to contraction speed. The next characteristic is fatigue, and we'll look at the difference in skeletal, cardiac, and smooth muscles. With regards to fatigue, skeletal muscles are easily fatigued. Yes, they are fatigued. Cardiac muscles are not fatigued, and smooth muscles are not fatigued. With regards to nursing risk, if you keep skeletal muscle immobilized, they may lead to muscle atrophy. With regards to nursing relevance in cardiac muscles are subject to heart failure evidenced by edema. With regards to smooth muscles are subject to GI paralysis, leading to ileus. What is ileus? Ileus is a condition where the intestinal muscles stop working properly, thereby preventing the normal passage of food, fluid, and gas. Objective number 7. We want to look at the characteristics and composition of muscles. Take note of this. In compartment syndrome, capillary pressure of about 30 mm mercury will lead to muscle ischemia. This will further result in necrosis in about 4 to 6 hours. There is therefore need to monitor for the 6 P's. If these are not monitored, there could be a resulting surgical emergency. Do not wait for pulselessness, because a pulseless state may be a state of no return. We want to look at tissues and membrane of the human body. We look at the characteristics and the composition of muscles. Skeletal muscles are long fibered, they are multinucleated, and they are striated. They are also rich in blood supply and they fatigue easily. What is the nursing link to skeletal muscles? Skeletal muscles are usually the areas for intramuscular injection, and there is also a condition of muscle fatigue in patients. We will also look at cardiac muscles. Cardiac muscles are branched fibers as they have a single nucleus, they are striated, they are made of intercalated discs for synchronized contractions. What is the nursing link with regards to cardiac muscles? Heart diseases and ECG interpretation. The next is smooth muscles. Smooth muscles are spindle-shaped cells. They have single nucleus and they are not striated. They contract slowly but sustained. Nursing links. They are relevant in conditions such as peristalsis, blood pressure regulation, and labor contractions. In a nutshell, we want to look at the structures of the skeletal muscles, their definition, and their clinical application. Muscle fibers. Muscle fibers are single cell with multi-nuclei. Nursing relevant to muscle fiber are in rhabdomyolysis. Rhabdomyolysis is a breakdown of the muscle, which is evidenced by myoglobinuria, which is muscle tissues in the urine. The urine will appear as tea-colored urine. So when you see a tea-colored urine, what does that indicate? It indicates myoglobinuria. The next structure is myofibrils. Myofibrils contain two filaments, which is the actin and the myosin. While the actin is a thin filament, the myosin is a thick filament. How does myofibrils apply to nursing practice? It is relevant in condition called malignant hyperthermia. In malignant hyperthermia, there is increase in calcium ion release. So malignant hyperthermia is a rare life-threatening genetic disorder whereby exposure to certain anesthetic agent or muscle relaxant trigger uncontrolled skeletal muscle metabolisms. So there is excess calcium ion release from the sarcoplastic reticulum into the cytoplasm of skeletal muscles. This will cause it to be rigid and unrelaxed. There is also increase in temperature, and there is need for the nurse to give dantrolene. What will dantrolene do? Dantrolene is given in order to stop the uncontrolled muscle contraction. The next structure is the sarcoma. The sarcoma is a functional unit and is also called the Z-line to Z-line unit. In muscle cramp, there is spasm of the sarcoma. There is need for stretching and hydration. Another structure of skeletal muscle is the motor unit. Skeletal muscle have motor unit, which is made up of the motor neurons around it and all the fibers it innervates. What is the clinical application of the motor unit? The motor unit is applicable in amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is a progressive neurogenetic disorder that affects the motor neurons, which are the nerves that control voluntary muscles. So in ALS, there are motor neuron deaths, which will lead to progressive weakness. There is therefore need to assess respiratory effort of the patient. We want to look at some physiological theories of how muscles function. The first muscle function principle we'll look at is the sliding filament theory. What is the mechanism with regards to the sliding filament theory of muscles? So in this concept, actin slides over myosin using ATP energy. How is it relevant to nursing? It's relevant in hypokalemia. In hypokalemia, there is reduced ATP, so there is muscle weakness. There is therefore need to monitor ECG for U waves. So once you look at your ECG machine and there is a U wave, you just know that this could be reduction in ATP as a result of hypokalemia. There is another principle called the all or none law. The all or none law is applied in muscle fibers contracting fully or not at all. So the all-in-one law is a muscle and neuron physiology that states that when a muscle fiber or neuron is stimulated to its threshold level, it responds fully, producing a complete contraction or action potential. What this all-in-one law means is that muscle fibers and neuron either respond completely or not at all. There is no partial contraction or an individual muscle fiber. How does this apply to nursing? It is applied with regards to partial seizures. Partial seizures occur as a result of abnormal neuron firing. There is therefore Answer these questions in the comment section. Which bone is more prone to osteoporosis fractures? Number 2. What are the 6 P's of compartment syndrome? I want you to answer this question in the comment section, as it makes me know if you enjoyed the video. You don't just see bones and muscles, you diagnose with them. When you assess capillary refill in the toe, you are checking perfusion to skeletal muscle. When you prevent hip fractures, you are protecting cancellous bone in the elderly. When you recognize compartment syndrome, you are saving the limbs with muscle anatomy knowledge. Master musculoskeletal anatomy, and you turn every assessment into a life-saving intervention. I want to thank you for staying tuned up to this time. If you haven't subscribed to our YouTube channel, kindly subscribe and let us know how these videos impact your nursing career journey. Till we meet again, it is bye-bye. Thank you.
The Career Pathway Channel. Guiding nurses to success.